between 15 and 20% of the global cancer incidence shows cause. There's cause of cancer linked to specific infections. So there are certainly bacteria and helminths that contribute to the development of bladder and rectal cancers, to cholangiocarcinomas. However, viruses are in fact the main cancer risk factor associated with infections. And there are, one of the interesting things particularly about viral infection is there are latency periods of several decades between the primary infection and development of the respective cancer. That is very important to us in terms of traditional Chinese medicine, in terms of integrated therapies. So most people who are infected either clear the infection through the immune system having a response in which the virus is cleared, or the body will harbor the viral DNA for a lifetime within specific cells without symptoms. So that's what is meant by a latency period. Now, one of the things that we also understand is while it's called a latency period, that does not mean that there are not symptoms or there are not signs of these infections, particularly from a Chinese medicine perspective, which is something that we can talk more about. But this is a very important part of this. So the viruses that are related to cancer, the flaviviruses, like hepatitis C is actually the only one in that category. Hepatinoviruses like hepatitis B, which causes HCC. Human papillomavirus, HPV. The herpes viruses like Epstein-Barr virus and HHV8, which are associated with cancers like Burkitt's immunoblastic, nasopharyngeal, Hodgkin's disease, Kaposi sarcoma, Castleman's. There are retroviruses like HTLV1, HTLV2 that are associated with chronic lymphocytic leukemia, hairy cell leukemia, and then human immunodeficiency viruses, which do not specifically cause cancer but are related to many cancers through immunosuppression. So in terms of the viruses related to cancer, hepatitis B and hepatitis C, when you hear someone talking about primary hepatocellular carcinoma or primary liver cancer, the cause of those primary liver cancers are hepatitis B and hepatitis C. That's what that means. So what would be a secondary liver cancer? What causes secondary liver cancer? You guys can type into the screen and anybody here can answer. I was saying alcoholism, so alcohol damaging the liver. So that actually would be a primary carcinoma, actually. So there's another one. These are the viruses are primary cause, but alcohol, it can be a primary cause of hepatocellular carcinoma. But what's a secondary liver cancer? Okay, so we have an answer here. Metastases, toxicity, cirrhosis, and metastasis, chronic inflammation. You can be a little bit more specific? So secondary really means basically metastasis. It would mean that someone might have breast cancer or lung cancer, and then what somebody comes in and says to you, oh, I have liver cancer. They don't really have liver cancer. They have a liver tumor that has been a metastatic tumor that has come from another cancer. So sometimes what happens is that people may have more than one disease, more than one issue going on, and so it may be found that a person has a secondary tumor and not a primary tumor, and it's treated completely differently. Because if you were treating, for example, in terms of Western medicine, if you're treating somebody who has a secondary liver tumor, you are going to treat the primary site or the primary cancer, basically. You can have you won't necessarily be treating the cancer through the methods that you would treat a primary liver cancer. I'm actually not going to talk about all that today because that's a whole other class on specifically liver cancer and liver disease. However, I just want you to understand that that's what that means when somebody comes into your clinic and says, I have liver cancer. You have to actually determine whether that is really what the person is saying. And so some of the ways that you're going to learn what the true answer is some of the things I'm going to be talking about, which is gathering information from the patient and also from the doctors that they are seeing in advance or during the course of your treatment to be able to understand exactly what's going on from a Western perspective. So anyway, so hepatitis B and hepatitis C cause primary hepatocellular carcinoma of the liver. HPV causes anal cancer, cervical cancer, vulvar cancer, oral cancers, cutaneous cancers, and other cancers. In fact, HPV is the leading virus that is associated with cancers. I'm not sure if all of you know that, but it's there's actually a lot of propaganda going on right now around the vaccine for HPV, in which there was actually a whole special on PBS the other night, which I was kind of watching, interesting, in an interesting way, because there's a lot of controversy around the vaccine, although there are many, many people who believe that the HPV vaccine should be used. There's a lot of issues around it. However, one of the things they were really, really promoting was the use of vaccines, and there was not a lot of there was not a lot of information on the other side. They didn't talk about that HPV vaccine basically only covers HPV 16 and 18, and that there's a lot of other HPVs that are associated with cancers, or several others that are associated with cancer, and so there's not a protection for other HPV viruses. Even though those are 70% of the viruses, it's still 30% is a lot, and there can be millions of people who can get cancer from HPV that is not an HPV 16 or 18. Anyway, that's a side, but it was just something I was. So look for that show on PBS. It's very specifically about vaccine, and I thought it was pretty interesting. So HIV does not directly cause cancer, as I already mentioned. However, it is associated with increased susceptibility to certain cancers.